Hello everyone, welcome back to another YouTube recall session. So today we're going to discuss with you about the recall questions of AIIMS 2018 Physiology subject. So let us start the discussion. So the first question is, which of the following is the diluting segment of the kidney? So this one is simple and straightforward question. The diluting segment of kidney is actually ascending thick loop of Henle, in which sodium and chloride comes out of the lumen and water tubular fluid becomes diluted. Okay, so the answer here is C. The next question is, identify the ions A and B based on conductance graph of a neuron shown below. So there is A and there is B. Okay, ion permeabilities. Okay, so let us look at the graph. A are actually fast activating channels, and these are all slow activating channels. So the fast activating channels are actually sodium channels, and the slow activating channels are actually the potassium channels. So A is sodium and B is potassium, so the answer here is A. The next question is, how is an electrical synapse different from chemical synapse? The options are no cytoplasmic continuity between presynaptic and postsynaptic membrane. So this one is true statement because in electric synapse gap junctions are present. So there is no cytoplasmic continuity seen between presynaptic and postsynaptic membrane. So this one is true statement. The direction of impulse is unidirectional. No, it is actually bidirectional. Connections are involved in electrical synapse. This one is also wrong. Connections are not involved in electrical synapse. And the last statement is electrical synapse has more latent period than chemical synapse. This one is also wrong. So the answer here is A. No cytoplasmic continuity between presynaptic and postsynaptic membrane. The next question is, hormone degradation as an important mechanism for regulating local concentration is seen in. So let us look at the options. 11 beta hydroxysteroid dehydrogenase inactivation of glucocorticoids. This is an important hormone degradation mechanism. Yes, it is for regulating the local concentration. The next option is thyroid hormone deiodinases inactivating triiodothyronine. This one is also true. The next option is degradation of retinoic acid by CYP26B1 in primordial germ cells of males. This one is also true. So the answer here is all of the above. Okay. These three are the hormone degradation important mechanism for regulating the local concentrations. Okay. The next question is the factors that can cause a person to drink water due to stimulation of thirst mechanism is or are. So let us look at the options. Dehydration, yes, it can cause a person to drink water due to thirst mechanism. Hemorrhage, obviously yes. And prandial drinking, this one is also true. So the answer here is D, all of the above. The next question is on performing a histamine test on an individual with brachial plexus trunk injury, you can expect the first option is central capillary dilatation, then wheal and then surrounding flare. So first of all, let us look at the brachial plexus injury. It is a type of post-ganglionic injury. Okay. So central capillary dilatation and then wheal and then surrounding flare. This one is not seen. Central capillary dilatation wheal without surrounding flare. This is a classical sign seen in post-ganglionic lesion like brachial plexus injury. So this one is true. Central capillary dilatation will with exaggerated surrounding flare. This one is wrong. And absent triple response. This one is also wrong. So the answer here is B, central capillary dilatation and wheel without surrounding flare. This one is a classical example of post-ganglionic injury which is seen in brachial plexus trunk injury. The next question is GFR is increased by all except. Let us look at the options. Increased renal blood flow. Yes, it increases GFR. The next option is afferent arteriolar constriction. Yes, it also increases GFR. Ureteric stone. No, it decreases GFR. Decreased oncotic pressure. Obviously, yes, it increases GFR. So the answer here is C. The next question is baroreceptor provides. Classical, straightforward, simple factual question. Baroreceptor provides negative feedback. Okay. The next question is the diagram below shows the pressure volume curves for three different lungs. Which of the following is the best representation of compliance between the three lungs? Who has highest increasing lung volume? Has the highest compliance? Okay. So B has the highest compliance, then A and then C. So the answer here is B. Okay. The next question is identify the site which is responsible for relieving pain when pressure is applied to the painful area. First of all, this one is the cross section of brainstem at the level of bones. Let us mark all the areas. This one is periaqueductal, gray matter consists of raphe, nucleus. C1 is the medial lemniscus. D is medial longitudinal fasciculus. And B is corticospinal tract. The site responsible for relieving pain is actually periaqueductal gray matter, which releases opioids. So the answer here is A, periaqueductal gray matter. The next question is inhibitory control by the hypothalamus is exerted on. So this one is a simple and straightforward answer. Inhibitory control by hypothalamus exerted over prolactin and growth hormone. Answer is B. The next question is, which of the following hormones play a permissive role in the attainment of puberty? Let us look at the options. Gonadotropin releasing hormone. No. The next option is leptin. Absolutely yes. It performs permissive role in attainment of puberty. Okay. Insulin no, growth hormone again no. So the answer here is B, leptin. The next question is Weber-Fechner law relates magnitude of sensation to. Simple, straightforward, factual question. It relates the magnitude of sensation to the log of intensity of stimulus. The next question is the following Darrow-Yannet diagram is suggestive of which condition? Note, the solid line is the original fluid compartment and the color shaded compartment within the dotted line denotes the change caused by the condition. So what is happening here first of all? This is actually hypoosmotic volume contraction, and that is happening lead to decrease in volume and decrease in osmolarity. So this is actually due to hyperosmolar fluid loss. So this is mostly seen in adrenal deficiency because aldosterone hormone deficiency that will lead to hyperosmolar fluid loss. Okay. Excessive sweating lead to increase in osmolarity and decrease in volume. Diarrhea lead to hypoosmolar fluid loss, and SIDH is also lead to hypoosmolar fluid loss. So in both these cases osmolarity increases, but in this case osmolarity decreases. So the answer here is adrenal insufficiency. The next question is the mechanism by which glucose is absorbed in the intestine is. Simple, straightforward question. Secondary active transport. Answer here is B. The next question is the earliest stage at which erythropoietin is effective in red blood cell formation is. This is again factual question. Straightforward. Erythropoietin is effective in red blood cell formation at earliest stages. Burst forming unit. Answer is A. The next question is integrin actually connects with laminin, fibronectin and collagen. It helps to connect intracellular cytoskeleton to the outside world. Okay, so the answer here is C. The next question is which of the following organelles is absent in the area of the cardiac muscle marked? Area marked is muscular area, no nucleus. So mitochondria is seen in this area, Golgi bodies, and endoplasmic reticulum. These all are seen, but lysosomes are seen in perinuclear area, means the area surrounding the nucleus. So this is not an area surrounding the nucleus. So the answer here is B, lysosome. The next question is which of the following fibers reach the Purkinje cell directly? Let us look at the options. Inferior olivary nucleus. This one is true because it is the deep nuclei of cerebellum. Okay. So this fiber reach the inferior olivary nucleus directly. Raphe nucleus, no. Vestibular nucleus, no. And locus ceruleus, again, no. These are not deep cerebellar nuclei. So the answer here is A, inferior olivary nucleus. The next question is calculate the net filtration pressure across the glomerular basement membrane for a patient with glomerular ultrafiltration coefficient is equal to 6. Glomerular hydrostatic pressure is equal to 45. Glomerular capillary oncotic pressure is equal to 20. Bowman's capsule hydrostatic pressure is equal to 10 and Bowman's capsule oncotic pressure is equal to 0. So they are asking about the calculation of net filtration pressure. Net filtration pressure is equal to hydrostatic pressure of glomerular capillaries, oncotic pressure of Bowman's capsule minus oncotic pressure of glomerular capillaries plus hydrostatic pressure of Bowman's capsule. So let us put the values together. Glomerular hydrostatic pressure is actually 45 plus Bowman's capsule oncotic pressure is 0 minus glomerular capillary oncotic pressure is 20 and Bowman's capsule hydrostatic pressure is actually 10. Okay, so this is in the bracket. So this is actually 45 minus 30 is equal to 15 millimeter of mercury. So the answer here is D, 15 millimeter of mercury. The next question is in a 100-meter dash, most of the energy consumed by skeletal muscles to replenish ATP is derived from. Again, straight forward factual question. So it is derived from phosphocreatine. 85 percentage of energy contributed by this. For example, very fast run for first 10 seconds, the energy comes by phosphocreatine. If you can say that after 10 seconds to 2 minutes, then energy comes by anaerobic glycolysis, not aerobic glycolysis. It is anaerobic glycolysis. And 2 to 4 hours marathon, the energy comes from oxidation of fatty acids. The next question is, in the homunculus, which of the following has maximum representation? The maximum representation is seen in homunculus is increased preciseness of movements. Because the movement with most precision are the ones which has the maximum presentation. So the answer here is C. Increased preciseness of movements. The next question is, what is the usual position of the Golgi apparatus in serous acinar cells? Factual, straightforward question. Golgi apparatus in serous acinar cell is situated at the supranuclear location. Okay. Answer here is A. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.